your host, Shafat Oliver, on the 22nd of April, and this evening I want to discuss a statement that was released by doctors that we should maintain the restrictions even if the government lowers or lessens or lifts the restrictions, which is the exact opposite of my position, which is that we should never go further than the government restrictions. He believes that we should, even when there are not restrictions, we should maintain the restrictions. And that's what these doctors have signed to. So let's look at this. So this is from Ari Elman from Baltimore. And let's look at this statement. All right. So he says, this is important. The date is very important, of course, the 19th of April. So that was just 3 days ago. Physician's statement regarding premature lifting of restrictions. As physicians who are Shomer Torah observant and on the front lines of the active COVID-19 pandemic, we implore all fellow Jews to continue strict adherence to isolation guidelines without exceptions. So, no, what this means is that even though everyone else in the state is allowed to, act normally, we should continue living in a bubble, and we should maintain these restrictions. Well, this certainly does not fit with the original argument for the restrictions by those who put forward the mathematical models, that the purpose of the restrictions is so that the hospitals not be overwhelmed. Why? Because there would be vast numbers of cases. Even according to these models, it was assumed that the disease would spread regardless. The purpose of the measures was not to prevent the spread of the disease completely. The presumption was that the disease could not possibly be prevented from spreading. Rather, the purpose was to slow the spread so that the hospitals would not be overwhelmed. That was the only purpose. Well, how does that make any sense if only one community practices the guidelines, but everyone else does not? That would not make any sense. Okay, so he goes on. Our Jewish communities require unique consideration and are at higher risk for rapid disease transmission. We live in a close-knit, multi-generational, and interconnected communities with frequent overlapping contact in our religious commitments, and so on. So, okay, so we have more contact with one another. So what? Why does that mean that if we lower the restrictions, that then the hospitals will be overwhelmed? We're still a minority community living in a country with many other inhabitants. And if everyone else is lowering the restrictions, then, whatever will be, will be. Our choice to maintain the restrictions will not affect the general population, the greater good. It won't mean that the hospitals won't be overwhelmed. Okay, further. Halacha, Jewish law, has never looked towards government guidelines alone as a measure for sakonas nefashos, of danger. Government guidelines consider political factors. Okay, now I agree with this. Financial impacts and enforcement capabilities. Absolutely, yes. We cannot assume that any advice from the government is only being told to us from the consideration of health and safety. There are other considerations involved. All right. We do not believe that any of these weigh more heavily than the concept of pikuach nefesh, of danger to life. Okay, well, many people have pointed out that a financial impact is in reality a danger to life. It's a danger to health, and there have been rise in suicides, there have been a rise in break-ins, in violent crime, and in domestic violence, and in um, uh, all kinds of severe depression. So this is definitely related to safety in that sense. Um, well, so they say we do not believe that any of these weigh more heavily than the concept pikuach nefesh, of danger to life. Well, that all presumes that you have some kind of clear calculation of what this danger is. It's not enough to say in general that there's danger, because there's always some danger. There's always some concern. Every year there's a flu, and we don't take all these measures, even though these measures might prevent some people from dying from the flu, yet we don't take all these measures. Now it's turning out, even according to the official news, that the number of people dying, at least overall, not in New York, but overall, has been no different, comparable to the numbers during a regular flu season. So therefore, when you say that pikuach nefesh, danger to one's life, is the most important consideration, that's technically true, but it still begs the question of what's your proof that the situation is so dangerous? The original basis for that was the prediction from the Imperial College of London, which told us that 2.2 million Americans would die. And that's what Fauci quoted. And based on this belief that there was some severe impending danger, we took these measures. Well, now it turns out that those measures were completely exaggerated, no comparison whatsoever, especially in light of Sweden, where no lockdown was imposed. So, where there were not vast numbers of deaths, only deaths similar to the regular flu season. So, therefore, the entire basis for these measures is gone, even officially, according to the news reports. These measures were based on faulty, incorrect predictions. So, what are you saying? There's a danger to life. You have to explain why you think there's a high danger to life and exactly what that entails. Is a danger to life that the hospitals will be overrun? Well, the hospitals will not be over. You're maintaining the restrictions in one community will not affect that. Okay. Quote, it is painfully obvious that government guidelines must be tailored to keep our communities safe. All right. Well, that's just too general a statement. It is our unanimous medical opinion that prematurely loosening the restrictions is highly likely to result in further disease transmission and loss of life. God forbid. All right. It's your unanimous medical opinion. Well, what about all the people who did not sign on to this document? So they don't count, I guess. It's highly likely to result in further disease transmission. Well, what's the proof that people who get the disease die at high rates? That is the issue, isn't it? the death rate. What percentage of the people who get the disease die from the disease? At first, we were told there's a high percentage. It turns out that it's an extremely low percentage, and yet all these doctors are, I don't know, they're living in an alternate reality where they claim here essentially that catching the disease would very likely lead to a loss of life, which is just out of touch with the information that we now have based on facts on the ground, as opposed to mathematical models, which are completely unreliable, as anyone who knows about these models and knows the record of such models predicting pandemics in the past would know. These people, these are really doctors. They're not epidemiologists. They're not any more qualified to analyze these issues than anyone else just because they're doctors. That does not give them expertise. They are talking outside their field when they come and tell us that by their authority, we should limit our freedoms in our communities and keep our schools and our shuls, our synagogues closed. They don't have the authority to tell us that because they're not epidemiologists. They're just doctors. And all they're saying here is there's danger, there's worry. Okay, that's not a rational argument. If they're if they're doctors, then they should explain to us why they think the likelihood of death is so high, when the information that we're seeing now is that it's extremely low. Continuing, we must remind everyone that COVID-19 can be transmitted asymptomatically. All right, so what? The issue is not whether you get it. The issue is what the chances are that you'll die from it. People get the flu every year, and in fact, large numbers of people die, and yet we don't shut down society. Continuing, and that those who have had COVID-19 may be contagious for weeks, even after resolution of all symptoms. In addition, people who have had COVID-19 may not be immune. All right, yes, that's quite possible. Maybe there's no immunity created through having had it. Maybe. Any outing from the home must be limited to essential needs and performed with the strictest social distancing regulations. The prohibitions on all forms of group gatherings, including Simchas Levias and Minyanim, must remain in place. All right, well, you know what? You don't have any authority to tell us that. We can analyze, and you never had that authority in the first place. We can analyze, intelligent people can analyze the studies, in particular the one from the Imperial College of London, decide for themselves what they want to do. If they think it's dangerous, let them stay home. If they feel that they have weak immune systems, let them stay home. In this situation, everyone's staying home. What does that accomplish? If the main thing is that the people who have weak immune systems should not catch the disease, which is ultimately completely impossible, ridiculous. People with weak immune systems will lock themselves at home for the rest of their lives? No, that's not possible. Plenty of people functioning who have weak immune systems function in the world where there are diseases and they manage. And sometimes they don't. But we don't tell them that they should be agoraphobic, that they should just have such fear about the possibility of catching a disease because they have a weak immune system that therefore they shouldn't function in society. We don't tell them that in general. So why should we tell them that now? We should not. And all the more so in this case where you're forbidding healthy people from functioning normally because of a concern for this tiny minority. What you really have to explain is, what is your proof that the danger is so great, with COVID-19 in particular, that these measures are necessary? Prove to me that it's very contagious. Prove to me that there's a high death rate. Prove to me that that these measures are really warranted. Just as we empathize with patients undergoing difficult treatments, we also understand the difficulty that these guidelines impose. Oh, thank you. These temporary measures are not easy to follow, but are medically necessary and life-saving. Right. Well, in the coming weeks, new information and advancements will become available, which we hope will allow for loosening of restrictions as a concern for pikuach nefesh for danger to life allow. So what they're essentially saying is, we're going to be imposing other restrictions on you, which will allow you to function normally. Only then will we allow you to function normally. And we're telling you that these restrictions are necessary and they're effective. Okay. Or you can see the images, the scary images of this big ball with these are not real images. These are artists' impressions, you should know. Designed to scare you, fearmonger. We, the undersigned, unanimously support the above statements. All right, almost no one in Texas. Huh. All right, you know what? In New York, I can be more understanding, but many of these places, there are no vast numbers of people dying in the news, and yet these doctors, these MDs, mostly, they're saying that these measures should be continued even when the government is no longer requiring them. It's absurd. All right, so let's look at a little at the comments here in this thread. So he says, Ari Lichtman asks, holy and adult, is the right time to reopen? Right? It's a very legitimate question. You're saying that there is a need now. Well, won't this virus continue to exist later on? It's going to disappear? Aren't we now being told that it'll return every year? So, yeah. Please do not answer with rhetorical, sarcastic questions. What specific things do you refer to when you talk about advancements in coming weeks? 100% coverage on vaccines or testing? Any other magic you refer to? Okay, so Ari Elman, who is the initiator of this document, he went and, recruited doctors to sign this statement, which I don't have a problem with that, with people, gathering signatures for statements. The question is, what's the content of the statement? Okay, so Ari Elman answers, at the absolute minimum, we need two things in place: widely available rapid testing ability. Okay, so this will mean that if you want to go to shul, if you want to go to a funeral, or if you want to go to school, you want your child to be able to allow to school, you have to submit to a test. Your child has to submit to a test. And widely available serologic testing for immunity. So that's a blood test. So you have to submit to a blood test. So there'll be physical tests. You'll have to be subjected to physical tests in order to be allowed back into this club of public events, or, public activities in the Orthodox Jewish community. That's what Ari Elman is saying is in the works. Yeah, we know that's in the works. Well, he has very great faith in the effectiveness, the efficacy of these tests. Widely available rapid testing ability. Well, these tests were proven. The PCR tests were, we now know, did never test for COVID-19. So I don't see how suddenly there'll be tests for COVID-19. Rather, the tests merely tested for coronavirus in general. And even then, it was fuzzy as to just how effective they were. Okay. Will we have widely available testing in a few weeks, or are we just pushing off a re-evaluation to that point? It's really more likely going to be a few more months. A valid question. Yeah, you're saying that we're going to have these tests and then we'll be able to go back to normal. Do you really know just how long that will take? No. This is real guesswork on the part of these doctors, and in particular the one who wrote the document. Everyone else just endorsed the document. Maybe they made corrections. So he has great faith in the ability of medicine to come up with these solutions in this short time frame. All right, now we have a comment. We are keeping people alive while working more hours with less pay and less protection than ever. Always remember the 1918 flu pandemic and what happens when restrictions are lifted, right? So the 1918 flu pandemic was vastly more severe, vastly more deadly, but we're constantly barraged with the talk of that event so that we will feel fear and we will conform with whatever restrictions they demand. So, yes, it's told that restrictions were lifted and then, many more people died. So, somehow, therefore, in the current situation where COVID-19 has been shown to be, in effect, no different in its lethality from the yearly flu, well, the same thing must apply now. So it's a complete false analogy. We seem to be turning a turner, but there's a ton we don't know about the virus. Yeah, no kidding. There's a ton you don't know. So why are you telling us? Why are these doctors telling us with such authority as if they do know? All they've said is that there's a concern for loss of life. Well, that's too general. That's not a statement of authority that takes into account all the facts. What don't we know? Mutation patterns, herd immunity, duration of immunity, RO over time, optimal treatment algorithms, and targeted therapies. Yeah. Well, you know what you didn't know? You didn't know how dangerous it was in the first place. There was a false mathematical model that was pushed to promote the narrative of lockdowns and curfews and social distancing. It continues, until we at least have achieved a decrease in the number of new cases and the ability to test for both disease and immunity, it doesn't make any sense to lighten things up. Well, firstly, there has been a decrease in the number of, deaths, but new cases, well, the issue is not whether a person gets it. The issue is what are the chances that he'll die from it? That's the real issue. It could be that more people will get this, will have this condition than get the flu in a regular year. That's not a concern. So more people will get the flu or something similar to the flu. So what? The issue is, what are the chances that they'll die vis-a-vis the regular flu? Yeah, and they have to have this ability to test for both the disease and immunity. Well, you have no idea how long that will take. I know that you don't have an answer, and that's, yeah, but it's way better off than dead, right? Always scare us with death. We have to conform to their demands. Why? Because death, 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 death. People are dying, so therefore listen to us. Well, no, that's not an argument. You have to explain in detail the threat assessment with full knowledge of all the facts. And if you don't know the facts, well, then don't claim to know what we should be doing. And based on that ignorant assessment, essentially ignorant assessment, dictate to us what to do. Let us assess the matter. We're concerned about our loss of life. It's a danger. We're concerned about that. But it doesn't follow. Each individual can consult with their own doctor or their own medical authority that they think is sufficiently educated and qualified to make such uh, express such an opinion. Um, okay. Denver's double humped curved in 1918. All right, so because at that time there were interventions removed, therefore there was a big spike after. So therefore, if we lower the restrictions, which is what protesters want, it is true that is what protesters want, and I agree with them. If we lower the restrictions, then suddenly there'll be a big spike. Yep. So be afraid of death. And we know that that'll happen, even though we don't really know what's going on. But we know that we're worried about death, so therefore you should listen to us. Ari Lichtman, you really need to start thinking about this as public health emergency and not a political game. No, he didn't. He was asking a valid question. Question is, what is your time frame for lowering the restrictions? You need to take off the Fox News glasses here and take a dose of reality and examine the science. Indeed, examine the science, Ari Elman. Consider what is the exact death rate, meaning to say, if you calculate how many people got the disease, what percentage of those people died? If it's very low, and it has turned out to be very low, then it's not a public health emergency. And also pay attention to the fact that many doctors have reported that they got instructions from above that they should report cases of people with COVID-19 as having died from COVID-19. And even without a diagnostic test, which the tests themselves are unreliable and do not test for COVID-19, even without that test, simply based on the doctor's presumption that this person probably had COVID-19, he is assumed to have had COVID-19. That's also being counted in the death toll. Well, that means that we're getting fake statistics, and it means that it's not the public health emergency that we're being led to believe. Okay. Okay, going down. Ari Lichtman responds, this is not a public health emergency. It is a compromised immune system person emergency. Right. The issue is specifically for this tiny number of people, which we're told are much more likely to die from the disease if they get it. Which, has that been proven? I don't know. But that's the claim. It's not a claim that the average person is at high risk. Continuing, it is also a don't overload our health system, our healthcare system, so flatten the curve emergency. This two-in-one emergency comes at the expense of our nation's economy. Before blowing your top at the characterization, flatten the curve of the dramatic response and talk real numbers. Exactly, talk real numbers. Are we about 10 to 1 asymptomatic versus tested positive? So it's actually more like 0.4% or less mortality. All right. Do we have so many who will pounce on any pharmaceutical optimism? In other words, you doctors and the people supporting the statement and promoting the statement, who penned the statement, they have great faith in these pharmaceutical treatments. We're like, we need a solution. Who says this solution will be truly effective? Maybe these tests won't be accurate. Maybe, maybe, maybe they'll just be a placebo, just to quell people's fear. What's to say? Like, why are people so confident that if it's a pharmaceutical solution, that then it will be effective? The reason is simple. The same reason that they naively accepted the original doomsday prediction based on medical authority. Oh, some professor who's an expert said so. Well, it's in the same way that they will accept a solution that has something to do with a pharmaceutical product, a test or a blood test or some kind of temperature test or what have you. Also, keep in mind that everybody would actually have to get tested every day, because even if you didn't have the disease the day before, you could have it the next day. I mean, I guess unless you could test for immunity, but what's the proof that that technology exists to test someone about whether they have immunity? And in fact, this statement itself says that just because you got it before, that doesn't mean you have immunity. So the reliability of any of these measures, these pharmaceutical measures, is very questionable. It's very doubtful. But these people hold so much trust in them that they've, even before they exist, even before these solutions exist, they've already told us that once the solution comes, then we'll allow you to go back to normal according to our professional opinion. Okay. So many cannot get past a reopening without either a vaccine or 500 million test kits arriving in mailboxes daily, along, of course, with lots of checks. Right, yeah, this would cost a complete fortune, all these pharmaceutical products. This situation is now totally outside level thinking and completely political, and I gave that a like. Right, it just makes no sense. All right. Ari Elman responds. First, yes, let's back up for a second. Yes, people with compromised immune systems are at risk, but also old people. If you're willing to sacrifice your parents for your job, then you are right. I guess there isn't much to talk about. Yeah, well, it's this extreme dilemma, this extreme uh, choice that we're faced with, that it's very emotional. It's a very emotional argument. it's not true that that the argument for the lockdowns is that older people shouldn't get it, because it's impossible ultimately to protect older people from getting the disease if it's so contagious, unless they simply shut themselves in their houses for the rest of their lives. But that also has very harmful effects on one's health. So um, it's really wrong to say that um, to present it in this way. If you are willing to sacrifice your parents for your job, then you are right. Well, obviously, no one is willing to do that. It's a false dilemma. The virus is also killing plenty of previously healthy people with no comorbidities. Maybe, I guess that's possible. And even if we believe your bogus 0.4% mortality number, well, no, it's not bogus at all. It's, in fact, understated. If everyone in the United States gets the virus, you're looking at 1.4 million deaths. Right? These are all based on assumptions, complete assumptions. As for pouncing on pharmaceutical optimism, maybe you should accept that some people have different expertise than you do, right? So we can trust that these pharmaceutical products, they will solve the problem. We can trust them because they're experts, even though many times in the past, pharmaceutical products turned out not to be such um, effective solutions, but they're experts. And see which treatments are more likely to be promising and which are likely to be bogus. When you asked me 3 weeks ago, I said I would 100% try remdesivir or another treatment that at least a physiologic explanation for why it may work, rather than a drug that only had so the French doctor, so he completely dismisses hydroxychloroquine, whatever. Um, Ari Elman, you've got some interesting tinfoil hat friends. Yeah, anyone who questions the narrative is a crazy person, right? If you doubt, or if you just ask legitimate questions like, how long are you going to keep our communities shut down? What's wrong with that question? Or you ask a question, well, isn't the death rate pretty low? No, then you're a tinfoil hat person. I guess it depends what 1.4 million lives are worth to people. Well, no, it doesn't follow that just because there's a certain death rate, um, which is a guesstimate, that will necessarily mean that if we lower all the restrictions, that there'll be that number of people dying. It just doesn't follow. And also, you have to compare it with the yearly flu. And this has turned out to be not worse than the yearly flu. I don't know how you explain logic to people who don't value 1.4 million lives. A 5-year-old girl in Michigan just died. Her dad was a firefighter and mom a cop. Right? So basically, people died. People died, people died because people died. Therefore, you should listen to whatever the quote unquote experts say. Don't question them. People died. Sure, it's one case and anecdotal, but extrapolate small percentages of 5-year-old kids dying across the entire US population, and that's a lot of dead kids, right? So because a little girl supposedly died from coronavirus, so therefore, even though that's a tiny minority of the number of kids, but if we lower the restriction, restrictions, then large numbers of kids will also die. Completely doesn't follow. And also, we don't know that that child died from coronavirus because they're, as we said before, the coding, the classification for coronavirus is in death certificates is completely, uh, unscientific. It's a clear agenda to inflate the numbers of deaths because that's the narrative they want to push. All right. I don't know how to put a price on that, right? Yeah. So again, you're a murderer. All right. Ari Lichman, break out the singular examples, folks. That's what you're now up to, right? Yeah. So people died. I know somebody who died. I know a few people who died. It's all beside the point because those people may well have died from the flu, or they may have died from something else just because they're old. Or maybe the fact that they died is not an argument. We're talking about probabilities over here. Ari Elman, these are medical professionals who are telling you what they are seeing on the ground. Yet you would rather listen to Dr. Oz and Dr. Phil's take on Fox News. Unbelievable. Right. So, medical professionals, basically, some people are dying, and therefore do whatever these doctors say, which is what Ari Elman, composed for them to say. Yeah, so he accuses this other fellow, the other Ari, of only caring about promoting, I don't know, some kind of conservative agenda. Right. Ari Elman. Ari Lichman, what if you become a singular example and I'm the ICU doctor on call at Hopkins that night? How would you like me to proceed? Well, anyway, that's not a logical argument. That's just an emotional. Okay, Ari Lichman, if the vulnerable are on full lockdown, then the math equation you seek is moot. Precisely the point. Exactly. The obvious question. Why is there expectation, a requirement that anyone who's not vulnerable should also seclude themselves, isolate themselves? Why? Why? What's the logic in that? There is no logic in that. The people who have compromised immune systems, they're the ones who should be on lockdown, if anyone should be. I don't think they should be either, because they're not the rest of the time, and there's no proof that this is far more deadly than the regular flu. Ari Lichtman, someone says, everyone is vulnerable. That's what everyone here is telling you. Well, yeah, that's not an argument. Yes, everyone is vulnerable. Question is just how likely is it that they will die? Ari Lichtman. First, I appreciate your and other professionals' efforts. Forgive me, but is it possible your immersion has caused a loss of perspective for the general population's daily experience? No disrespect, right? So just because you are in an ICU, that doesn't prove that the number of deaths is in a way that warrants these responses. That's not for you to say. You as a person working in the ICU, you're seeing only the emergencies, only the bad news. You're not seeing the general population. So therefore your estimation is flawed, or it may be flawed. Further, he says, at present, the rights of most are compromised for the sake of the vulnerable who are locked down too. This is not about equality. Okay. Lock down the vulnerable, let the economy move, and send them checks if they have notes from their physicians. Now we're talking. Okay. It's like talking to an anti-vaxxer. Give up. Let him go out and contract it. Yeah, it probably is like talking to an anti-vaxxer, because anti-vaxxers are people with logic, and when you try to scream at them and call them names, well, that does not faze them. They want to talk logic. So yes, it is quite like talking to an anti-vaxxer. All right. Well, thanks for listening. Ignore this statement. Open up your shawls. Don't require anyone to have these dumb tests. They're anyway very questionable as to their effectiveness. And anyway, there's no need to worry. The only place where I would say that things are less straightforward is in New York. And the question is, what exactly is going on in New York that's different from other places? And I won't go into that now. But if you're not in New York, I didn't see any basis for a extreme response in the first place. Certainly not now that the wild predictions were completely debunked, and really the only statement that should be made is a complete retraction and apology for telling people this is the statement that the doctors should come out with. These doctors should come out with a statement apologizing that they relied on a very speculative opinion from someone who had a record of making doomsday predictions with his mathematical models that turned out to be completely incorrect and unscientific and based on uh, very questionable presumptions and insufficient data. So that is the statement that the physicians who previously, from the outset, called on the community to um, take on these restrictions and go further than what the government was telling them. The government allows gathering of 10 people as long as they do social distancing, but the doctor said, no, you shouldn't do that either. So the real statement they should come out with is a retraction of the original statement, the original support for these measures. Now that it has turned out, it's clear, it should be clear to all that these predictions were completely incorrect and flawed from the beginning. And the only reason that the doctors supported them was their just blind trust in anyone who calls himself an expert. You know, everyone needs to learn that they should be more skeptical, including these MDs and these rabbis who were swept along with the MDs. Just because someone says he's an expert, that doesn't mean you should necessarily accept his words. This fellow had a record. This fellow, Neil Ferguson, had a record of, um, exaggerated predictions, but that was all ignored. He's an authority. This is his area of expertise. This one guy with his team, that's enough. The fact that other professors disagreed, no, we're going to err on the side of caution and listen to the one who's making the most dire warnings. That wasn't right. The doctors should come out with a statement admitting that they made a big mistake by relying on these supposedly opinions with their mathematical models. Okay, God bless. Good evening. Thanks for listening.